Okay, good morning. Welcome, everybody. Hopefully, everyone's had a chance to figure out coming into the Zoom room. My name is Sujay Mehta. I'm the Director of Global Health Education at Solidarity Dental Foundation, which is a US-based 501c3 nonprofit charitable organization dedicated to oral healthcare and research and data and all sorts of fun stuff for underserved folks from all over the world. And I'm really excited for this panel that we have for you today. We have Dr. Tina Saw and Dr. Jessica Kleback, who I will introduce momentarily, talking about hopefully as you've gotten into the right Zoom room for leveraging AI and technology for global oral health collaborations. I just wanted to kind of give a little bit of preface to this before we get started. Uh, AI and new technology for some, this is a very exciting component, and for others, it brings up a little bit of fear and concern. And I just wanted to go over a couple of things, both from sort of popular culture and film, but also a little bit of history. My background, my first degree is in history, so I can't help myself but include some aspects of this. Um, so one thing, when a lot of people ask about what is AI, in 1935, Alan Turing described a computing machine with this element of a limitless memory and an ability to scan and look at documents and basically uh, create more programming to program itself and improve itself. And just an idea. And that kind of developed throughout the 40s and 50s. And in 1956, John McCarthy is credited to introducing an artificial intelligence applied to computer science, using the computer to adopt human thinking and decisions and behavior. And the goal being to increase efficiency and precision. And that's absolutely, crucial in healthcare. But while some feel AI should supplement or augment what humans can do, the worry is that could artificial intelligence replace humans? And then, we adopt things from science fiction like replicants from Blade Runner or, a cyborg assassin from Terminator. But before that, in I believe it was 1968, there was a Stanley Kubrick film, 2001: A Space Odyssey, and there was a computer, HAL 9000 or HAL. It was some heuristic algorithmic learning device, and the computer on this spacecraft figures out that the astronauts are going to unplug the computer, and HAL, this computer, has a mind of its own and then decides to kind of kill off various astronauts. And so I guess your question is, well, what does that have to do with oral health? And certainly, I think the main issue is as all fields advance with technology and AI and large language models, we want to really work on improving aspects of that patient safety and efficiency and care. Um, and I think it has massive implications when we're looking at oral health for international populations and underserved populations and elements like that. It could really help as far as improving efficiency. One of the things that we have seen with health, with 3.5 billion people affected by oral health, there are educational models and using new technology, whether it's Instagram Reels or TikTok videos. Technology can really have a massive influence on improving whether it's tobacco cessation, oral hygiene, all sorts of fantastic public health education campaigns. We can improve and ramp that up with technology. So it is in fact an exciting time. Incorporating artificial intelligence and new tech into global oral health. And I think the three of us are very grateful for the Global Health Council for inviting this panel and hosting this. So with that, I wanted to we'll start off with Dr. Tina Saw. who is the CEO of Oral Genome. She's spoken all over the place. I see her speaking at quite a few events, a very charismatic and charming speaker. And she's going to start us off first, and then we'll move on to our second speaker, Dr. Klebeck. So, Dr. Saw, to you.
Thank you so much. Okay, so I'll give a little brief introduction about myself. My name is Dr. Tina Saw. I am the CEO and founder of Oral Genome. We're a point-of-care dental saliva test, and I'll share a little bit more about what we do. I'm also the founder of Harmony Health Foundation and also serve on the board. What we do at Harmony Health is we help increase access to care not only in the US, but we also do this globally too. We work with different ministries of health across the country and across the world to kind of move and utilize AI, utilize point of care saliva testing, utilize teledentistry. Any way we can get people to access to care, that's what we do. And especially in these rural populations and people who don't traditionally get access to care. So I'll probably share a little bit more later on, but I kind of wanted to jump into personalized dentistry through technology and dive deeper into how technology is used to really bridge gaps in care. Sorry, 7 a.m. early here. So we're going to talk a little bit about precision in oral health care. It's a really hot topic right now. When we think of precision in oral health care, it's essential to recognize how this approach reshapes the entire patient experience and the efficacy of treatments. The first point is personalized treatment plans. With advances in technology and data analysis, we now have tools to create tailored treatment plan strategies that goes beyond the one-size-fits-all approach. This means considering a patient's unique saliva, genetics, lifestyle, and risk factors, cultural factors. We can craft the most effective and personalized treatment plans for them. The level of customization is not only going to improve patient satisfaction, but also compliance and adherence to their treatment protocols. Another thing is early detection and intervention. That plays an absolutely crucial role. Precision tools in oral health, such as saliva-based testing and advanced AI imaging, it allows us to identify potential diseases long before they manifest into severe conditions. And so when we catch these diseases early on, like caries, periodontal disease early, we can intervene proactively and prevent more invasive procedures and preserve natural oral health structures for as long as possible. The next thing is cost-effective care. Cost-effective care is a natural outcome of this proactive approach. When we identify problems early and customize treatments, patients avoid more expensive and complex treatments down the line. Precision dentistry allows healthcare providers to use resources effectively, provide high-quality care that is often budget-friendly for both patients and the healthcare system. And finally, the last thing is improving oral health outcomes. It's essential goal of precision in oral health care. Oral health, as many of us know, is deeply linked to overall systemic health. It influences conditions such as diabetes and heart disease, and precision care bridges the gap between dentistry and general health by ensuring that we're not only treating oral health symptoms, but also contributing to the patient's holistic well-being. The result of having a healthier population and a more integrated approach to healthcare really underscores the importance of oral health as a foundational element of global health and general health. This approach together is transformative. We really want to position oral health as a key component of preventive medicine and really foster like future treatment plans that are more effective, and preventive care is really prioritized and patients really enjoy better health outcomes. So why does oral health matter? I know a lot of you guys know this, and it's a lot. It's all over the internet right now in the medical and dental industry. We talk about this, but it's more than just a bright smile. It's more than just a set of teeth. It's actually a window into your overall well-being. It plays a critical role in maintaining not only our ability to eat, speak, and socialize, but also in protecting our body from diseases. We know the mouth is a mirror to what's actually happening inside the body, and it's often the first place where signs of systemic diseases appear. This is because the mouth is full of blood vessels and nerves, and they're acting as that vital entry point to the body's circulatory system and other key organs. One significant connection is between oral health and is also heart disease. We have seen a lot in a lot of studies that inflammation and bacteria associated with gum disease can travel through the bloodstream, contributing to plaque buildup in the arteries and increasing the risk of heart attacks or strokes. And this really highlights the untreated oral infections can really impact cardiovascular health. There's also a strong relationship between oral health and diabetes. Poor managed blood sugar levels can increase the risk of developing periodontal disease and vice versa. And severe gum disease can make it even harder to control blood level sugar, creating a really, really harmful cycle. So when we address the oral health, we're addressing and making a pivotal role between managing diabetes and improving an oral patient's overall health. Another important link is with respiratory diseases. Bacteria from infected gums or teeth can be inhaled into the lungs, leading to respiratory infections, especially in oral adults or those who have weakened immune systems. This can also result in exacerbated conditions like pneumonia. And additionally, pregnancy outcomes can be influenced by oral health. Poor hygiene has been associated with premature birth and low birth weight, possibly due to inflammation that is triggering early labor. So when we recognize these connections between oral health and systemic health, we're not only just preventing cavities and bad breath and periodontal disease, but it's a really critical component of preventive medicine. When we prioritize oral health, we're helping reduce a whole variety of systemic diseases, and we're fostering better overall health and quality of life, and also reducing the long-term cost of medical health. This integrative approach emphasizes that oral health is an essential part of holistic health and impacts the well-being of all our body systems. So when we talk about breaking down barriers and innovation in patient care, it's really essential to consider how advancements in technology and reshaping the way individuals interact with their health. What we do, for example, as I mentioned, I am on the board and the founder of Harmony Health Foundation. What we do here is we're integrating smart devices and home health solutions, and we're seeing a way to boost patient engagement. This isn't just about convenience, it's all about empowering individuals to take an active role in their oral health and turning that passive checkup into a more proactive, ongoing oral health management plan. As part of this innovation is leveraging preventive care strategies informed by insights we can gather from something as simple as saliva testing that is point of care. These insights allow for early detection of potential health issues and monitor and create tailored personalized interventions, significantly improving patient outcomes. Innovation in patient care isn't solely about the technology itself. It's about how we integrate and approach these solutions together, and accounting for cultural considerations and technology adoption, not that are in our tools, not only advance, but also make everything accessible and inclusive. At Harmony Health, a nonprofit I founded in 2023, we've seen firsthand how powerful this integration can be. We've been able to utilize the technologies to serve over 2,400 individuals, demonstrating that smart tech-enabled technologies can really make a huge difference in patient care. Right now, we have over 20 partners. We serve over 6 states. We have really harnessed smartphone technology in difficult populations such as the IDD, intellectual and developmental disabilities, to be able to utilize smartphones to actually get better oral health outcomes. So later I'll specify some examples of how we've accomplished this and the impact that we have made. So what is saliva testing? Just really want to transition this discussion on how this can be very pivotal. Saliva testing has been out there for a while, but this point of care innovation that is more newer onto the market exemplifies how the integration of smart data-driven solutions embodies how we can use preventive care strategies to improve oral health outcomes. So what is salivary testing? It involves analyzing a sample of saliva to detect biomarkers like bacteria, enzymes, and hormones, giving us a comprehensive look into a person's overall health and potential risks. Unlike blood tests, saliva tests is very non-invasive. There's no poking. It's all cost-effective and it's very easy to perform. Anybody can do it, not just a dentist, and making it a very practical tool for any patient. How is saliva testing useful? For starters, it supports early intervention. By catching signs of oral diseases early, we can prevent them from progressing into more severe conditions that require very extensive, costly treatments. This feeds into our strategy of empowering patients through personalized care, where treatment plans are tailored based on the unique markers detected in their saliva. And lastly, there is a practice advantage, which is implementing salivary testing is going to elevate your patient satisfaction and feeling like they have this whole care, and it really helps clinics globally feel like they're really advancing preventive care. This quote on the slide highlights a crucial point, which is saliva tests, due to their accuracy, ease of use, and cost effectiveness, are proving to be invaluable in both clinical and basic sciences. And this aligns with our mission at Harmony Health and Oral Genome, which is to enhance patient engagement through really smart technologies. Our experiences have really proven all that, and leveraging all those insights, we're able to bridge gaps in care and promote wellness on a broader scale. So it's really easy to do. As I mentioned, I talk a little bit more about this. We have been really at the forefront of transforming how we approach salivary testing. Our process is really simple. We have a 3-step process, which makes it really easy for patients to be able to get these critical health insights. It begins by scanning to register the test on the box, and you're going to collect the saliva sample, place it into test wells. And one of the significant impacts at Oral Genome has made is that smartphone technology. There isn't a device that needs to be sitting in a medical office or a health center. It's all processed using a mobile phone in any patient's hand, and you can get that immediate actionable data. So what we do is we guide users. You download the app, the testing process. You're going to go step by step, download the app, you create an account once the app is installed, and then you're going to go ahead and add all the patients that you are testing for that day. You enter in the lot number, and that's going to start preparing the test. Our collection device is very easy to utilize. It's a foam piece that you're going to filter all that saliva. It takes out all the mucins, and it takes anywhere from 30 seconds to 3 minutes to collect the saliva, depending on if you have dry mouth, it'll be more on the 3-minute side. If you do not have dry mouth, it's probably going to be about 30 seconds. Once you collect the saliva, you're going to drop it into the buffering solutions that come into the box, and then drop them into the test card. And the process is really, really straightforward. There's, like I said, no mailing back. We don't collect your saliva. and save it and store it. Everything is thrown away immediately into in your home trash or in your clinic setting. Oops, sorry. Um, After placing the saliva into the wells, you're going to take a picture of the test card, position it on our placement card. This card is going to help you guide your analysis and where to place it so that we can get the computer vision just right to read it. Once you have everything lined up, you take a photo using the Oral Genome app, and then this will do the image processing. From here, all you do is wait for the results, and meanwhile, you're doing a caries risk assessment and then the diabetes risk tests. And then voila, in like 2 minutes, you're going to get this oral health report. You'll get these things in real time. We do salivary pH, which is an indicator of acidity in your mouth, buffering capacity, how your saliva's ability to neutralize acids. P. gingivalis, a key marker for the presence of bacteria that is associated with periodontal disease. Salivary proteins, which is how you protect your teeth and gums. MMPA, which is an enzyme that is linked to tissue breakdown in early detection of perio disease. Nitric oxide, which indicates inflammation and overall oral health status, and glucose to look at diabetes and your blood sugar levels. So you're going to go ahead and a doctor can download and send and export the report. This is what it looks like. Just an example of where it can, what a provider can see. And so when it comes down to what your patients are really thinking, it's patients are seeking more personalized care. And that trend is very, very clear from the data. We did a national survey involving 515 participants ages 18 to 86. And with the average age of 47.5, 72% of respondents were saying that they wanted innovative tools like saliva testing and oral genome at their next appointment. 68% of participants found that personalized results from tools were valuable or very valuable. 81% of people said that there's a high likelihood of wanting to use a test kit and app. And then 52 said they would actually consider switching clinics or a dentist if they were not offering some sort of technology like ours. So it's very clear the perceived benefits of what patients are asking for, which is early detection of conditions, allowing patients to address potential health issues really, and checking the progress of things. Monitoring oral health helps really maintain wellness and prevent diseases. And the convenience of the test makes it accessible and user-friendly. So patients want empowerment and knowledge, and they want to be very proactive in their oral health. So this shift towards personalized care underscores a new standard in patient experiences and demonstrates that many AI and computer vision tools are essential right now in dentistry. So technology, what are our biggest challenges? What are our biggest wins? We would love to kind of share a little bit more. One of the things is that we really believe in innovation in patient care. Innovation in patient care is about integrating technologies to simplify healthcare and extend its reach beyond traditional settings. It's more about like when we don't want patients, accessibility sometimes is difficult. And so it's not really necessary through technology to have to sit and wait in a doctor's office. Point of care testing gives you these immediate health insights paired. It's similar to, we can do blood monitoring, use telehealth, virtual visits. We can use AI analyze intraoral photos, AI x-rays, like things like video health, all from the comfort of your home to be able to actually work with a physician or a dentist to actually go through your medical or dental health. One of the key aspects of innovation is using inexpensive remote monitoring devices And the combination of real-time patient monitoring and data collection really facilitates quick intervention when it's very necessary. And beyond that, it enables delivery of treatments, mobile care, preventive services, going to community health settings, all these things, especially when we're facing a shortage of providers nationally and globally. Screenings can be done virtually, allowing patients to connect with doctors anywhere. And the convenience and flexibility of those tools mean that healthcare providers can be available remotely, supporting patients wherever they are. The shift towards innovative patient care is redefining accessibility, efficacy, efficiency, and personalized health management, ensuring that high quality care is no longer bound by a physical location. So, what about its impact and the future implications? Well, the impact of leveraging AI and technology in oral health is transformative with far-reaching implications of the future of global healthcare. When we incorporate advanced technologies, we can accurately quantify disease burden, establish community development task force. We can really develop a dental and medical referral network. We can enhance dental policies and also help with collaboration. When we collaborate with governments, research institutions, dental organizations, and tech companies, we can work together to build these robust frameworks for the adoption of technology in oral health care. And this collaboration can really drive innovation in developing AI tools and culturally adaptive and accessible outcomes across different socioeconomic backgrounds. When it comes down to clinical care recommendations in oral health, there are several strategies that we can all implement to optimize care in a global scale. And we've talked quite a bit about this. Like I said, train and incentivize community healthcare providers, facilitate that medical dental integration, bridge those gaps, bring the professions together, leverage technologies, and also develop specialized care curriculums. So with that said, I'm actually going to hand it off to Dr. Jessica, who will talk more about leveraging AI with video health. And so I'll hand the mic off to her.
Thank you so much, Tina. What a great presentation. Really exciting and thoughtful things that you presented. And so I'm just going to sort of build off of Tina's presentation here. And sort of talk about how AI and some of those technologies can all sort of come together. I do have a disclosure statement here that I am currently employed by Video Health as the head of clinical effectiveness, but the views in this presentation are my own. I also serve as the director of programs at the Solidarity Dental Foundation, which is a global oral health foundation that we started to improve access to care to underserved communities across the globe. So just wanted to really highlight what is dental image AI, right? I mean, what is it and what is it not? There's a lot of misconceptions about technology in general, and Sujay kind of highlighted this at the beginning of the presentation. It's sort of a buzzword, and there's some concerns. Is it taking your jobs? Is it taking, is it as good as humans? Is it better than humans, right? All of these things. And so just a little bit of level setting about what dental image AI is. It's a diagnostic tool for oral health professionals. It is, it is really like an add-on to the dentist or to the dental hygienist. It's not replacing them. And so what it does is it assists in detecting early disease, sometimes hard to identify disease, just like Dr. Saw mentioned in her presentation. Early disease detection is really important for patients. And, as we start to all understand the importance of disease prevention, especially with the link to oral systemic health, it's just, another key way for detecting disease early. And it's also an unbiased analysis across all patient demographics. We talk about implicit bias and some of those concerns that we have in public health and in our research. And so, by implementing AI, we're able to remove some of those biases that just, providers tend to have. So I'm sorry, Tina, if you don't mind just going back for just a quick second. So I just wanted to highlight, AI is not a replacement of dentists, right? It doesn't replace clinical judgment and decision making. It doesn't substitute, your need for, preventive dental care and examination. It's a tool, not, a replacement. So just wanted to make sure we highlight that kind of as we move forward. Gone. Thank you so much. So we've done some studies as far as care standardization, and I'll kind of highlight why this is important a little bit later in the presentation as well. But what we've found is that by using artificial intelligence for reading dental x-rays, dental clinicians, regardless of their experience level, improve their detection of dental cavities. And so this first bell curve you see is unaided detection of decay. And so, some providers detected more true decay than others, but obviously most kind of fell in that middle range. It was a really, really even distribution of detection of dental decay. Then when you add in the AI, and this is where it's really getting at, it's the dentist plus the AI. Not only did we see increased standardization by the bell curve tightening, but we also saw it shift to the right. And so what that means is that more dentists were detecting more disease, but even the highest performing dentists without AI performed better with AI. And so this is just a really powerful study in highlighting how it can be used to standardize care, and how it's used to standardize care across all populations and all providers. So, I know we have a mix of healthcare professionals and interest in this room, right? But this is just, a standard dental x-ray that you get when you see a dentist, and, kind of even the untrained eye, you can see a few things, right? There's a missing tooth. There's, maybe, some fillings that this patient has had, right? But, with a quick glance, you might miss some earlier disease. And so if you go on to the next slide, now, even someone that maybe doesn't have as much experience or training in understanding dental x-rays can see, like, wow, like there's some red boxes that must mean, maybe some sort of early disease is detected, or there's some red lines, maybe there's some bone loss, there's some calculus, some tartar. This patient, has significant amount of dental disease just from in this one image. But now sort of it's a little bit more standardized. Even medical professionals, dental professionals, community health workers, they can all see now kind of the same thing on the x-ray and use this as a tool to then guide either their referrals to care or, patient education, all of those things. And so really what AI can help do is, level the playing field for everyone, but most importantly, the patient. So we'll go ahead and get into that next. So, as discussed previously, like, dentists have a lot of training to understand dental x-rays and what they are, what the disease pathologies are. It's a lot of gray scale, right? And, we go through 4 years of school and then all of our experience in clinics. And, sometimes we still miss things, and sometimes it is still hard to see and understand exactly what's going on. But for, patient understanding in the dental chair, or, even if it's done remotely, what we can do is really transform complex images to an understanding for patients visually. And so, it can create some interactive annotations and really break down some of those barriers, some of the oral health literacy barriers that we see every day as dental providers. And it leads to really powerful conversations with patients, where instead of like talking in grayscale and honestly being like, I don't know, patient, I know you probably can't see this, but I do, so trust me, to being like, I see it, the AI sees it, and now you can see it with these colors. And like, to me, that is one of the most powerful things that we can do, is help patients and communities understand the disease process so that they can make informed decisions to how, preventing disease for them. So just sort of, some roadmaps and some conversations on how AI and technology can be used for, population health analysis. And Dr. Saw, referenced this a little bit earlier, but, we have some standards in dentistry for, population oral health. And some of those standards are, what we call the DMFT, which is decayed, missing, filled teeth. And it's a score. The WHO uses it for determining population health of certain ages by country. A lot of researchers and funders commonly are looking for this sort of index, right? And what AI can do eventually is it'll be able to really standardize taking these scores, right? So if imagine, you're in an entire country trying to get this one index score, how many different providers, different opinions, different trainings, different, patterns of practice go into, getting this information and calculating it and analyzing all of the data. If we have a software such as, an AI software that can do this just by capturing the x-rays, and then it does all of that work behind the scene, not only are we going to have like more access to more data, but it's going to be more accurate data. And so that's, a really exciting, potential roadmap use case for dental image AI. And again, it really helps take out some of that bias, and it's a much more objective scoring methodology. And, for population oral health, it can also help generate comprehensive oral health status reports and identify population level trends instead of, just a person level trend. And so that's a really key target use for how AI can be used in the future. For example, with the Solidarity Dental Foundation, we received a grant to travel to Ecuador to collect the oral health status index of underserved populations in their farming and immigrant population in rural Ecuador. And it was a success, right? We collected the data, we crunched the numbers, we, found, high need in these populations, and were able to take some action steps based on our research. But it was very labor intensive, time intensive, and funding intensive to get this data for a really relatively small study and small population. And so if we could expand that using AI, or, and then additional technologies beyond that Dr. Saul was referring to, imagine, the impact and improvement to access to care that we could have. So just some really exciting thoughts on how these technologies that are just starting to become mainstream, just starting to really grow, how they can be used, for improving population oral health in general. And, then so again, expanding access to dental care. And Dr. Saw touched on sort of some of the remote diagnostics, right? So AI can be used for intraoral imaging and starting to understand disease. So even if you don't have a dental x-ray machine, we almost all have one of these, right? We almost all have a phone that you can take some images on. And then, eventually AI and some of those technologies in teledentistry, they're going to be able to help guide personalized healthcare decisions for patients. And, in these rural areas where, there might not be a dentist for hours, but there's cell service, right? And so that's, a really exciting opportunity for how we can leverage these technologies that are starting to come about to triage and prioritize dental care needs. And really reduce those barriers to care that we know so many populations have. And like Dr. Saul was saying, really important to start with that prevention piece, right? So ideally, we're not treating advanced oral diseases, we're preventing them. And then in doing so, we're also preventing all of those additional systemic diseases that she did such an incredible job highlighting, how it's all connected and how it can all, be improved with this technology that we're discussing today. And I know we only have a few more minutes, so I can go ahead and wrap up and we can open it up for discussion. Any questions or conversation? And then, yes, here is a slide with our contacts.
Fantastic. Well well done, both of you. The first up, I just want to say the slides were fantastic. And you both addressed concerns that I had, just, not being in this area. There's just some natural concerns that I think we all have that you both addressed amazingly. So thank you for clarifying some questions that I had. One of the things, well, as you heard my earlier sort of concern, maybe it could be a generational thing also, growing up in the 80s and watching Blade Runner and Terminator and such. The other movie, 2001: Space Odyssey, it's before all of our time. But I wonder if you have any thoughts or if you've come across any studies looking at the generational concerns, like is Gen X more concerned about AI as maybe I started off the talk compared to millennials? And so to Dr. Saw and Dr. Kleibach, any thoughts? Have you come across that? Is that a concern or is that made up in my head?
Sure, I can start, and then Dr. Saw, you can maybe add on if you'd like. It goes both ways. In general, in dentistry, people are just excited to prevent oral diseases, right? So patients tend to really lean into the technology because they're interested and they want to understand it better. I think historically there's sort of been this relationship between dentists and their patients, and where it's a little bit more, the dentist just, tells the patient directly like what they need, right? It's not a decision-making relationship. It's basically more of, the dentist just tells the dentist or tells the patient, and that's what they get. And so I think patients are actually really excited to start understanding their own health better. And I think that these sorts of technologies really help empower patients to do so. Providers, on the other hand, it is really interesting, and that's why I really like to share that care standardization piece. Younger providers are really eager for this technology. They are excited about it. They're really feel like it helps them as a diagnostic tool. Occasionally, not all, but occasionally you'll get, a provider that's been practicing dentistry for 30 years. I don't need that technology. I don't need it. I don't want it. And so that's where, showing this is making you a better dentist too, even though you've been doing this for so long. That's a really powerful message, because all dentists want to carry over the highest quality care that they can to their patients. And so if you have these tools that Dr. Saw and I are talking about to do so, why would you not, right? And so that's kind of an argument that sometimes I'll have with dentists that are a little bit resistant to the technology. Why would you not want to carry over this benefit to your patients? And that tends to resonate really well.
I definitely, you said exactly what was going on in my head. And those are the things that we also experience. Like my team, both at Oral Genome and Harmony Health, is we have patients that are actually wanting to utilize technology like AI and their smartphone to be able to better their oral health and personalized care and really to like be on top of things. And as I had mentioned in one of the slides, we did surveys of what patients were thinking on personalized care and technology. And it's easier for us, we find, to get the younger dentists on board. They probably utilize it in their personal life. Harder for us to actually get the older providers. But interestingly, when we go to the patient side of it, we you would think, like, my mom is not great with her like smartphone and stuff like that, but you would think that they wouldn't be interested. But once we like at Oral Genome and we do also like intraoral photos, and we also at Harmony Health, we also have an app that we also track where they're brushing. And when we get them all set up with it, the elderly patients actually take off with it and they like run and they do very, very well. So it's interesting because this is something that I guess is newer, but people and patients like our society is being driven towards utilizing smartphones for everything and AI for everything.
That's awesome. I mean, that's a real testament to the ease of the technology. If you can get someone on the older end of the spectrum to adopt the tech and use it and like it, that's a very good endorsement of the app and what you've developed. So I'm a little bit biased. Well, the three of us are all dentists, so I feel that our profession, we tend to be early adopters of technology. And so I, I, I'm kind of biased that dentistry could really be pushing the part about integrating with primary care. Tina, you mentioned this aspect of not enough providers, and the way the testing could be with saliva. I mean, it seems like a no-brainer to me that this could really take off as far as providing service to underserved communities or folks that don't have a primary caregiver. It could really sort of up the game for everybody in that regard. I guess not so much of a question, but more of a endorsement. But is there any I don't know, is there any research going on in that area? Is that as far as whether it's survey stuff, or I mean, I know Jess does a lot of mixed method studies. Maybe that's something that you guys could collaborate on. Another question, impact to dental education. What would you guys like to see? Because sometimes the dental schools are a little bit late to the game, medical schools also. Do you have any recommendations, any call to action for them as far as medical dental integrating this? What would you like to see?
I would love, honestly, I feel like medical school, you don't get a lot of training on oral health, maybe like a course and that's it. And on the dental side of it too, I know it's quite a hurdle to adopt new technology, and I believe we are getting there. And I'm excited as we are working ourselves with dental schools to really try to bridge that gap and get students to have the tools to understand saliva testing and also what salivary biomarkers are also related to the medical conditions. And that stuff that, it's going to take time to do, but it's all starting to slowly happen as everyone is just opening up to, what's been going on.
Yeah, to follow up, I do think not all, but a lot of higher education, dental and medical schools are starting to really understand that medical dental integration has been a word that's been around for a while, right? But it's never been fully successful yet. And I think they're starting to understand that to really have that success that we're looking for, technology is a key bridge for doing so. And so I think that, and I'm optimistic that, you know, a lot of schools are going to start adapting these sorts of technologies, knowing that that's really where we're going to see that medical dental integration that we've all been talking about, we've all been wanting, and that quite frankly our patients desperately need to have their overall health and, you know, oral health improve. And so I think that education platforms are really going to adopt maybe a little bit quicker, knowing now that these technologies will help with that piece.
Yeah, and just looking at the chat, Caitlin had asked a question as far as Dr. Saw, if you're, you know, working in low, moderate income countries, and you answered in the chat that yes, absolutely, working internationally, and you know, just kind of, to me, reinforcing that aspect of access to care. That I think that's the beauty of 21st century tech, is that we can really access folks that are struggling with having providers and that kind of primary care integration. Let's see. Well, the other question, you know, the ongoing thing with technology and with oral health. I mean, we both sectors have sort of struggled with you know, from a diversity perspective and accessing or creating access. So dentistry is traditionally, you know, private payer model of care. So there's some people that just can't afford care. With this tech, and you kind of explained it in the talk, but I want to give you a little bit more opportunity to take a little deeper dive. How do you address the concerns for you know, for tech bias or AI bias across different patient demographics?
Yeah, so one key thing that, you know, I hope and I know that our company does do really well is really takes a look at the data to make sure that like our data set is actually as unbiased as it can be. Right? So really deliberate decisions and thoughtfulness around where the data is coming from and who's included in that data. And so that's something that's been really top of mind and really key to, I think, this unbiased approach that we're trying to take for making sure that the AI models are trained on, you know, data that is inclusive of all demographics and, you know, everything from age to gender, to, you know, location, you know, kind of that whole big picture approach. So that's definitely something that's important for all technologies to consider and be really thoughtful about. And then also kind of who's training and who's developing the models and the AI and technology as well, right? So
Yeah.
you know, for us, one thing that's really important is when we're training these AI models, making sure that we have a really diverse group of oral health providers that are doing it, right? So making sure it's not just, you know, one type of provider, one type of gender, one type of you know, so really building in that diversity from the ground level has been really key for having successful AI that works for all patients and all populations.
That's awesome. And yeah, I apologize. We probably went a little bit over, but
Okay.
yeah, I want to thank you both for being here, and absolutely thank you to Global Health Council for having us. This was a fantastic talk, and thank you both. And look forward to further collaborations between the two groups with Vidya and Oral Genome. Thank you.
Thank you.